Assalamu alaikum. I am Professor Dr. Tariq Wasim, and you are watching our Facebook and YouTube channel, uh, Medicine by Professor Dr. Tariq Wasim. In a previous session, we talked about the art of history taking and gathering information from your patients. Now, this process of history taking or interviewing your patient is not complete within 10-15 minute sessions of initial examination, but it continues through the examination, physical examination. For example, while you examine your patient, you notice a scar of previous surgery, which was not mentioned in previous discussion, and then you ask about when that surgery was performed and what was the reason and what was the outcome. Similarly, once you have completed your physical examination and history, it's another essential component to explain to your patient what you find or what you are suspecting as a diagnosis and what are the various diagnostic or therapeutic options available for that very patients. Now, in an examination setting, like in a long case or in other examinations, once you have completed, it's an essential component that the candidate is observed for the counseling skills as well. And this comes under the heading of a counseling skills. In an practice or in an say while examining your patient in outpatient, uh, they would be followed up, and during next follow-up visits they would be discussed with about their investigations, their results, and what uh, various options they have for your treatment. Similarly, in hospital setting, when you are on ward rounds, you discuss with them the lab results that have become available or various further new developments. And this process of interviewing or say gathering as well as delivering information to your patients or their caregivers or relatives is a continuous process. Now, the objective of this medical interview, whether it's an initial history or whether it's in the follow-up visits or in counseling sessions, is first of all to collect the information which assists us in making a diagnosis, and this we call as history of presenting illness. We have to discuss with our patients the diagnostic procedures and therapeutic options which are available. We have to assess and communicate the progress or prognosis of the disease as it happens. We also want to establish a therapeutic relationship with your patients, that giving them what different options they would have for their treatment. It's equally important to understand your patient's values, what he values, his lifestyle, his comfort, his other say worries. They are all to be taken into consideration when you are managing your patients. And of course, the physician's role is to influence your patient's behavior regarding his disease. And most of the time, the patients with an illness are usually depressed, they are worried, and they need a motivation, and that motivation has to come from physician. But let's first make a diagnosis, and then once we have made a diagnosis, then the process of say further investigating or further managing starts on. Now, today we'll be talking about the art and science of diagnosis. So that's our topic for today's say presentation. How do you start thinking a diagnosis? The process of thinking a diagnosis, what is possibly wrong with your patients or what he suffers from, starts from the moment either your patient walks into your consultation chamber or you move onto his bed or onto his the examination room. And from very initial say look at your patient, the way he walks in, the way he his gestures, his say posture, all starts telling you that what may be possibly wrong with him or what may be suffering from. Of course, we in previous lecture mentioned about You note down the demographics, the age, gender, and occupation, and all that information. You ask about your symptoms and take a history of those symptoms. After the history is complete, you review all the medical history. As I said, the process may continue on through your examination routine as well. Then you perform a physical examination and look for physical signs. And then you create a differential diagnosis that there are these three possible disease processes can explain this patient's symptoms or his, say, suffering. After that, a differential diagnosis, if needed, you order some laboratory tests, go some like imaging or invasive tests, or in some cases you may request for biopsies. So all this process depends upon what you find on clinical examination and how did you assemble the information of say history and examination, and then you go on to describe prescribe certain say tests. Now, test may not be necessary in all the cases. Common ailments like flu, fever, headache may need just some reassurance and some, say, uh, antipyretics or analgesics, whereas in some further, say, conditions, you may need to have lab test as almost in all the cases. Once these lab tests becomes available to you, review them and in light of your patient's symptoms and reports, and you then try to make a diagnosis. And when this diagnosis is made, you of course start its treatment depending upon what intervention further is required, and then these patients has to be followed up. Now, this sequence of, say, making a diagnosis, thinking a diagnosis, revising, refining continues on throughout your encounter with your patients. This encounter may be as a medical student, you are given a task to take care of a patient, and it's not just job is finished that you have just taken a history and presented it. Try to always follow this patient on their next ward visits or rounds, and then discuss it with your seniors or colleagues or the house staff working over there. And as a practicing physician, of course, each follow-up visit in either outpatient or in on your ward round is an opportunity to make, revise, or refine your diagnosis. Now, this cannot be done unless you have a very methodical way of recording your findings. And these recordings, case recordings, are usually again headed in under the 4 5 Ds. You note down the demographics, you put down the data, you write down the diagnosis or differential diagnosis, you mention about the decisions which you have taken about your patient, and then of course the further development they would also be uh, recorded and discussed with the patients. This is an example of just the case notes, usually in the form of just the forms or tables. There is like the patient is 37-year-old female who's Pakistani, married. Next of kin is husband, and she works as an office clerk. And of course, you would note down the time, date, and mode of presentation. But while describing these things or while you're putting in case notes, it would not be like a typical, say, data in the form of, say, charts or something, but it would be more in the form of, say, a more descriptive data. And now this data, of course, we did mention that you have to uh, verify or authentify the source of that data or its authenticity. You have to, of course, note down the initial chief presenting complaints, history of presenting illness, you note down the past history, you note down his social and personal history, you note down family history. Of course, in case of female, menstrual, gynecological, and obstetric history is important. In children, developmental milestones would be noted down. If treatment previously has received, that would be mentioned. And then after your physical examination, you will also note down the physical signs. Now we start with a case scenario, and we'll take you through how to proceed with the diagnostic, say, process. Now you come across a 37-year-old lady who has been complaining of numbness, tingling, and pain in her right hand and forearm for the past 6 weeks. Pain is worse at night and on waking up in the morning. She is working as a clerk in an office and find it difficult to work on her computer keyboard with her right hand. She was recently diagnosed to have hypothyroidism and was prescribed thyroxine, which she is taking irregularly. In the past, she suffered from migraine and but had no attacks in last past 5 years. She was known to have allergy to sulfur drugs. She's married with two kids, 8, 10, and 7 years, and she's living happily with no gynecological issue. And her younger sister has rheumatoid arthritis. Now, with this is how you make a summary of your patient's clinical findings and history, and from there you start making a differential diagnosis. So, if I ask you, what is the possible differential diagnosis of this 37-year-old lady with pain and numbness in her hand? The differential diagnosis starts from the history, and then, of course, it is would be further elaborated through the physical examination. Now, the first diagnosis that comes to our mind is a possible carpal tunnel syndrome or a median nerve compression at wrist as a result of some soft tissue swellings as a result of maybe, say, uh, involvement in a joint process, epineuritic swelling or inflammation, or compression as a result of, say, myxomatous material being deposited over there. This similar finding can be that her cervical nerve roots are being compressed at the neck level or maybe in the axilla somewhere, and this may be cervical nerve root compression and C5-6 nerve root compression. Cervical rib can also explain these findings. She is hypothyroid, and hypothyroidism with their myxomatous material and other say accumulation is one of the possible causes of compression of median nerve at the wrist, and hypothyroidism or poorly managed hypothyroidism because of her irregular in taking in medication can be a reason for that. Now, the pain and difficulty in typing using our fingers, where the typing involves joints, the small joints of the fingers, our hands, proximal, interphalangeal joints, and wrist as well. And with the positive history of our sister being suffering from rheumatoid arthritis, so rheumatoid arthritis can be a possible differential diagnosis, and this has to be considered. Now, with this differential diagnosis in our mind, we take our patient to the examination chamber and then examine her. Now, what we find on physical examination, a pleasant looking lady sitting comfortably at the moment. Her pulse is 56 beats per minute, blood pressure of 130 over 80 millimeter of mercury, respiratory rate of 16, and temperature is 98 degrees Fahrenheit. Skin is coarse and dry. There are no visible joint swellings of small joints of the hands or wrist, and she can maneuver them very easily. But when you go on to focused examination of the problem in the right hand and right, say, difficulty in typing and all that, so you specifically look for the right thumb, index, and ring fingers have impaired soft touch and feel numb. She feels pain in these digits on wrist flexion and has difficulty in holding pen. There is no wasting of muscles and tendon reflexes were normal. The Phelan test and the tunnel sign were, as elicited by tapping on the volar surface of the wrist, were positive. Now, this is how you do a Phelan test. The maximum flexion of your wrist would cause pain and numbness in the lateral 3.5 fingers of the hand. And similarly, when you strike over the say wrist over the median nerve where it passes under this epineuritis, you would find say tingling or shooting pain in those three fingers. Now, these tests are specifically favoring a possible involvement of median nerve being compressed at the wrist level. This then mm, limits our differential diagnosis to the after the summary of the relevant data and history and physical examination and your differential diagnosis. And this provisional diagnosis or is now Carpenter syndrome due to right median nerve compression at wrist, which may be one of the manifestation of hypothyroidism. Once you have reached that diagnosis, you have to explain it to your patient as well, and then you have to take some decisions. Now, decisions are problem based. Patient is there for his problem, and you have to first resolve that she is feeling pain in her right hand. So, our active complaints at the moment is pain right hand and arm. Her inactive complaint, which she mentioned in her history, were that she was suffering from migraine and she was allergic to sulfur drugs, which of course will keep in our mind if we are prescribing any drugs which may contain sulfur element. But the first we have to focus on our active problem, and of course we have to confirm the diagnosis. And our plans would be that we will investigate, we will treat, and of course explain it to the patient and their relatives. Now, investigations, the relevant investigation. Not all the lab tests you would probably require. Nerve conduction study or electromyography would be probably the investigation of choice to confirm, say, any delay in conduction in the median nerve distribution at the wrist or maybe at the elbow or up in the axilla as well. She is known hypothyroid, taking her medication irregularly, so noting down her thyroid status would be important. So we may order fresh thyroid stimulating hormone and free T3, T4 levels. X-ray of the right wrist joint, just to exclude that she may not have and say some articular finding or may not have some hairline fracture from trauma somewhere in the past, which may be say contributing to this median nerve compression. So that would be helpful. Soft tissue ultrasound of the right wrist would help us in possibly noticing any swellings causing the nerve compression. And with the advent of newer modern technologies, MRI of the wrist joint may also be, say, useful. But you have to select your investigations according to your available resources, not only your resources in hospital, but your patient's, say, resources as well. So keep your list of investigation to the minimum which possibly would confirm the diagnosis. You need not to go for all the fancy investigations mentioned to elicit the diagnosis. Now, once you have made the diagnosis, then the process or the stage of treatment is reached. Pain relief would be through NSAIDs. Splinting the wrist joint would be helpful, but you minimize the movement at the wrist joint, and this rest itself would be helpful in reducing the inflammation and reducing steroids, both systemic or say in the form of local injections, are helpful and a mode of treatment for Carpenter syndrome. You need to explain to your patient and you have to give some instructions, like we may say that take more frequent breakouts to rest the hands. So continuous typing and continuous use of hand for say striking again and again would be say helpful. Do not do the activities that make symptom worse, like say say getting up from your seat with your hand pushed over the arms or over the table, because the for hyperextension of the wrist would make it worse. Cold packs can be beneficial or helpful in reducing the swelling, and of course, this kind of a wrist splint would be helpful in relieving the symptoms. Once you have, say, explained to your patient and then given some instructions, given them prescription, you want to know the development, how the disease progressed. We have to observe for new signs and symptoms if they develop during the course of illness. In few days or maybe there and then, some results of investigation would be available, which would help us, like you find some findings in the elevated TSH, you need to uh, increase the dose of thyroxine. Similarly, you find an hairline fracture and you probably refer him for an orthopedic consultation. You also want to note that the medicine you prescribed were effective in relieving the symptoms or not. And of course, there may be some change in problems or plans, or she next visit she starts telling about the painful interphalangeal joints, and which may shift your focus towards being rheumatoid arthritis, and you may like to investigate it further, or you find, as I said, a hairline fracture and you want it to refer it to orthopedician or to other consultant, and of course, then you would have to the consultation or referral to the other colleagues. Now, this consultation may be with the physiotherapist, it may be with the orthopedic surgeon or neurosurgeon, or maybe endocrinologist, depending upon the response to treatment and what the final diagnosis has. And that's how the diagnostic process works in. Patient seeks your consultation or they come for advice regarding their problems. You start with the information gathering. This information is interpreted in light of the available data. And this data comprises of your history, your physical examination, lab test, and you make a working diagnosis. And this working diagnosis then is communicated to the patients along with the plan for further management and if need further referral. And this the outcome of this is then judged by on a follow-up visit that the patient is improved or not, or whether there are new physical signs coming up your way. Now, it's equally important to record or document your findings. Unless you have, say, organized records of your findings, you cannot proceed with further. So the case notes are a very important component of medical records. They are written record of patient's medical condition. You may write notes while taking history, but it interrupts the active listening and maintaining an eye contact with your patients. So it's difficult to have do both things simultaneously, that you are talking to your patient and taking your notes. They would say interrupt the flow of his description. So it's similarly, while nowadays working on electronic medical records, you every time takes eyes off your patient or say listening, and you focus on your computers, so that interrupts. So it's better to just have a brief notes while interviewing your patients, and then say compile them in a more legible form and more organized fashion later on. Structured performance for recording history are helpful in early years of training, but it's not necessary to record every detail for each patient. Only relevant negative findings are to be mentioned, and document your initial findings, your proposed investigations, and management plan for that very patients. Now, the medicine is a science, but the practice of medicine is an art. And this art you keep on learning throughout your career. and you keep on refining it as long as you are practicing as a medical practitioner. Thank you.